For Session Update, I'm Shannon Loehrke. The Senate Republicans recently unveiled their legislative priorities for the 2016 session. Joining me in the studio to talk about those priorities with regard to health care is Senator Michelle Benson. Welcome, Senator.
Glad to be here. Thanks for having me back.
So, at the press conference, you spoke of authoring a bill that would allow people who qualify for medical assistance to have the choice to go on the exchange or Minnesota Care. Why is that important?
Well, for example, if you're retired, maybe you own your home and you're living off of Social Security and maybe a part-time job or investment income, you might have income low enough to qualify for medical assistance, but what if you don't want to be on medical assistance? What if you just want a regular health plan but would appreciate some of the tax incentives? Right now our system is designed to force you into medical assistance or off the exchange completely. If you're a family whose children qualify for medical assistance, but you as parents qualify for Minnesota Care, you can't choose to have your children on your Minnesota Care plan. So now you have two networks, possibly two different clinic systems. So instead of focusing on the system and how it works, let's focus on giving people more choices, more opportunities. And we wouldn't be buying the difference, we'd let them choose to spend that money. That's their choice. So that if they wanted to spend more on their health insurance than they would if they were on medical assistance, they can choose to do that.
At the press conference, you also spoke of the importance of consumer choice.
Yes.
And this is kind of related to what you're saying, that you want consumers to have more choice. You talked about a bill that would allow people to choose their different products. Can you explain what that means?
Well, right now we have a very locked down benefit set, and not everybody is going to use all of those benefits. What if you could buy a plan that was more tailored to meet your family needs and therefore meet your family's budget? Right now, as rates keep going up, nobody's proposing solutions to actually bend the cost curve or to improve choice for consumers. We seem to be locked into this system, and we're not going to think out of the box until we listen to some of these ideas, like letting consumers have more choice.
If consumers have more choice, there's a fear that then they would choose or maybe lean towards more high deductible plans simply because of the skyrocketing costs that you mentioned. The problem with the high deductible plans, I think, is that then people have health insurance and not necessarily health coverage. How can we address that?
And if you look at the plans that are offered in MNsure, many of them are very high deductible plans. So what we have now is resulting in high deductible plans, giving people more choice. If they are similarly situated with deductibles, but they have more choice and it lowers their premiums, that actually ends up being better for them.
I know in southern Minnesota there's a problem with people not having much choice on the exchange.
Yes.
The costs are very high. Does the GOP have a way of addressing that for this, especially southern Minnesota?
That's a really complex issue because we have different insurance zones in the state of Minnesota. Mayo Clinic is a gift to this state, but they do have higher costs than the Twin Cities' more competitive system where there are more providers who have to compete on price. And so before we say we're going to go to one unified pool for the state, I think we need to have some analytics, have an actuary look at it before we make that decision.
Is it possible to have the state go to
the single pool?
Right.
Yes, but again, I'm not going to jump in and say that that's a good idea until I see an actuary tell me what's going to happen to insurance rates.
You suggested that individuals should possibly also have the right to purchase plans from the national exchange, plans that are certified by other states. What kind of cost savings would come from this, do you think?
Well, if we look at, we have ERISA qualified plans, so large employer plans, the self-insured market. Then we have qualified health plans that meet the Affordable Care Act requirements. But in Minnesota, we have another level of mandate sets and restricted choices for consumers. If we opened up even just those plans that were qualified on the ACA, consumers would save money and they would have more choice. And so buying a federally qualified plan, which would be available from another state, I think would be a benefit to Minnesotans. They could meet their needs at a lower cost.
Do you know, are there any other states that allow their people to buy nationally? I'm just curious.
There are other states that are on the national exchange, but I don't know how that interacts with their regional insurance.
So you've been critical of MNsure.
Yes.
Many people have been critical of MNsure. What kind of solutions can you think of? Does the GOP have a process?
I have had numerous bills. First of all, before MNsure was even put into place, we had a problem with our county systems where most of our eligibility is done. Mm-hmm. Instead of focusing on solving a known problem, they decided to take a federal political policy and implement it here in the state. Mm-hmm. So instead of doing a very thoughtful, stepwise approach to our IT infrastructure, we decided we were going to do a 5 to 7 year IT plan in 3 years. Mm-hmm. And that has contributed to the failure of MNsure.
And even the governor said yesterday that they're not a startup anymore. A lot of these problems that they're having should be taken care of by now.
Right. And the governor chose as the first CEO someone who is not a project manager, somebody mm-hmm. who hadn't managed massive IT projects. She was a health economist. Mm-hmm. That is not a qualification for a massive IT rollout. Mm-hmm. And so failure of leadership at the beginning and a failure to say, you know what, we can't do this. We need more time. Not being willing to move from your position has hurt many, many Minnesotans. Mm-hmm. And so solutions, for example, a private exchange. Idaho has a private exchange. Oregon just went out for a request for proposal and got their bids back mm-hmm. on a private exchange. What if the county programs could be run through our new IT backbone, get that built out, mm-hmm. but our qualified health plans be run through a private exchange and interlink so that people could get premium tax credits without having to go through the eligibility program.
As it stands now, if people buy off of the exchange, do they still get the tax incentives?
No, they can't. The House actually had a bill, and the Department of Commerce is supposed to be working on implementing that, mm-hmm. and they're slow walking it. They don't want to do it.
You mentioned that your party's also working on some other initiatives for this session. Would you like to give a preview?
Well, not necessarily for this session, but as our vision for what Minnesota's healthcare can be going forward. Mm-hmm. What if one of my favorites is something called a premium aggregator, which sounds very complicated. Yes, not very good at branding, but right. Practical things mm-hmm. start out with bad names. What if you could take money from your employer, take money, say, from a charity or from members of your family, plus your own money, mm-hmm. and be free to pool those for purchasing your health insurance so that your employer wouldn't have to bear all the burden, but they could still help you accomplish your family's goal mm-hmm. of buying health insurance. Let's look at a 2-earner family where they each work for a small employer. Each small employer perhaps can't afford to provide the family coverage that the family would like. But if each employer could put a little bit in, maybe we have some excellent charities here in the state, maybe for those who are working poor mm-hmm. but would like to buy insurance, those charities could contribute. Mm-hmm. Maybe a grandmother wants to help their grandchildren buy quality insurance, and they could contribute in that premium aggregator mm-hmm. and give people the ability to pool money, perhaps save money for their deductible, and have some insurance security, some health coverage security that they owned, didn't depend on their employer, didn't depend on the state of Minnesota. Mm-hmm. I think innovative ideas like that will get brought to light when we have more people willing to come to the table and say, you know, the one-size-fits-all model isn't working for Minnesota.
Senator Benson, thank you again for visiting the studio.
I'm so grateful for you by inviting me down here. Thank you very much.